I'd now like to welcome James Malcolmson, who is another patient advocate. Mr. Malcolmson is the Executive Director of Scleroderma Canada and will be speaking to us on accessing patient supports. Mr. Malcolmson.
Thank you, everyone, for giving me this opportunity to spend some time with you to talk about Scleroderma Canada and the work they do throughout Canada to help better the lives of our scleroderma patients. I also want to thank Malcolmson for this opportunity to share with you a little bit of information about Scleroderma Canada. And Scleroderma Canada is always about trying to make the world free of scleroderma. We have not found a cure, but we also want to enrich the lives of the patients who are living with scleroderma. And we do that through our 4 key pillars, which is advocacy, patient support, education, and research. And together we work with the provincial partners throughout Canada to do all that work. So in terms of advocacy, just to let you know what's happening right now, what we're been doing for the last couple of years is that we've been advocating with provincial governments for the approval of PDE-FI, which is more commonly known as Viagra. And this drug is really, really important to help with our patients dealing with digital ulcer. I think it's really important to understand that a doctor once mentioned to a minister of health that she has a patient that comes and sees her twice a month for 3 days at a time. That patient leaves 3 young kids at home. So the impact on the family is very hard on them with 3 days without their mother being there. And also the impact on the healthcare system and hallway healthcare of having a patient in the hospital for 3 days. If we could get the drug approved, we could eliminate that. As the doctor had mentioned to the Minister of Health, this patient that I'm talking about is an actual male. And if that male would walk in and say, "Hi, doc, I'm having some issues with erectile dysfunction," she could give him Viagra and she would never see him again to come into the hospital for these treatments that are needed because that drug is not available right now for people living with scleroderma. And if it is available on a special occasion or a special cause, it is very, very costly and most of our patients can't afford it. We're also meeting with the federal government and the provincial governments this year to deal with getting approval for OFEV, which is a drug that is helping with interstitial lung disease, which is very, very important. That would help people's lives improve while living with scleroderma. In advocacy, we are advocating every year, and every year we line up different meetings with different provincial organizations. And you can see on this slide that you can see this year that we are going to be in New Brunswick, Saskatchewan, Ontario, Alberta, and also will be in the fall, depending on the election, spending some time at Parliament Hill. We also provide advocacy training workshops for our staff at Scleroderma, for our patients, for our medical professionals, and for our volunteers. We've heard over and over again the impact that we have on advocacy is the impact we have that leaves the most, has the most impact is the fact that we have our patients involved in our advocacy work and them telling their stories and politicians hearing those stories has worked wonders for us to move this along. Support. So we're always wanting to support our patients, and we do that through a variety of different ways. But one way we do it that's really important is through peer-to-peer monthly support groups throughout Canada, where there's a support group meeting that takes place, whether it's physically pre-COVID or virtually during COVID. Patients gather and discuss and just share their stories and learn from one another. And it provides a lot of support because for many of our patients live in a lot of isolation due to living with this disease. They live in isolation, especially in the months of November until the end of um, April, early May, with the weather being cold in Canada. So the virtual support groups are very essential. It's a very important for them to meet and discuss. And also, what we want to do with that is provide them with training and module. So we have partnered and worked with the SPIN network, which is Scleroderma Patient Centered Intervention Network out of McGill University. Brett Toombs is the doctor behind all this, and we provide those resources for them, and also provide support group leaders training on how to be effective support group person. Education. We're always wanting to educate you, the medical professional, and our patients. I wanted to talk a bit about what we do to educate our patients in terms of educating our patients and also the medical professionals. We have a biannual conference. So every 2 years we meet physically. We haven't been able to do that in 2020 or 2021. We did have a virtual conference in 2020, which was very successful. And we are hoping, fingers crossed, to be having a physical conference in 2022 in Niagara Falls, Ontario. Our conferences are always a big hit with our patients, and also very successful to have our medical personnel there all together collaborating and discussing from all over North America how we can improve the lives of patients living with scleroderma. We also provide education forum nights. These are done virtually now with COVID happening, but it's an opportunity for people to gather in their small community of Regina or in Halifax or in Hamilton, Ontario, and have present guest speakers come in from medical professionals to discuss the latest research trends, to talk about different things that are happening in the scleroderma world and educate them more. This is really, really beneficial to our patients, and more importantly, also their caregivers, because they're always looking for resources that will help them deal with living with scleroderma. In terms of research, our other pillar, we're always raising money to give money to research. Every year, researchers from across Canada apply for grants through our grant application process. We then review the grants, and depending on how the fiscal year has gone, we allocate the money to the research groups that have applied. Not always every research group, unfortunately, can get the money due to the fact of how much money has come in that year. We are, though, happy and pleased that last year, during this tough time for everyone and tough time financially for us, we were able to give over $125,000 in research grants to different doctors throughout Canada. We also are dealing and working with soliciting donors to see if they'd be interested in increasing their donation or increasing the amount they'd like to donate to contribute to research, so that we can have more money available to help try to find a cure for scleroderma. And then lastly, our pillars about awareness. And we do a lot of awareness through fundraising events. And one of those things that is on right now presently, and will be running throughout the month of June, is our annual Scleroderma Awareness Month, which is usually done through physical walks, but this year we'll be doing virtual walks. So you can go to hardword.ca and look at the platform that's there and how you can get involved and see all the great things people are doing virtually. Hashtag make a move for scleroderma. It's not just about walking. If you want to go gardening, you want to wash your car, you want to walk the dog, it's all about making a move for scleroderma. And that's what we're trying to do this year to raise more awareness and also raise dollars, vital dollars, that of course would go to research. We have an annual fundraising gala. Last time we did this was in 2020, where we met physically pre-pandemic, and we'll be doing it again this year in the fall, virtually, across Canada, coast to coast, We'll have Dave Hempstead, who will be coming in, who's a comedian, and Chad Brownlee, a country music artist, to provide entertainment for people virtually that you can enjoy the evening. We'll have meals and wine being delivered to your house. So it's a great event that we're hoping lots of people can participate and raise awareness. We'll also have our patients and a couple of researchers update the group on how the latest developments in scleroderma and from our patient's perspective, what it's like living with scleroderma. We rely a lot on our third parties fundraising events, which are fantastic for raising awareness. We have a small community, Lucknow, Ontario. A patient who lives with scleroderma owns a pizzeria, and they put on stickers on all their packages going out the door during the month of June to raise awareness. We have people doing yoga fundraisers. We have people, young kids whose parents live with scleroderma or parent live with scleroderma, doing lemonade stands, doing hot dog stands, just great initiatives that help us raise more awareness for everyone to understand. Because our biggest challenge is the fact that being a rare disease, a lot of people don't know who you are. Being a rare autoimmune disease is challenging when no one can say your word or spell your word. So anything we can do to raise awareness is so vital for us. We have annual golf tournaments that we do for people to have. Every December, we have a national blue ribbon campaign over Christmas time where blue ribbons are given out and people can donate in memory of or supporting someone and use them as ornaments on their Christmas trees. We, in February is the Rare Disease Month, and we have a balloon campaign where literally, here's the balloon here, we teach people and show people that how challenging it is if you live with scleroderma to physically grab the balloon because your Raynaud's in your skin, or if you have lung disease, how difficult it is to blow it up. And then we blow up the balloons and we share them across Canada of telling our stories, giving hope afloat. And of course, we're always active on social media, wanting to tell our story wherever we can. We're pretty excited that we were lucky enough to have Jason Alexander, AKA George Costanza from the Seinfeld days, who tragically lost his sister to scleroderma, do a nice social media post for us to promote our awareness campaign for June of 2021. So that it basically sums up all that we do here in terms of Canada to provide support for our patients. Once again, thank you, Mellencroft, for the opportunity to be here. Thank you to all of you for giving your valuable time to learn more and more about scleroderma. It's a hard word. It's even a harder disease, but together we can find a cure. Thank you.